So I'm Dr. Rob Riddell, and I'm here to tell you about acceptance and commitment therapy, which is spelled ACT but always pronounced as a word, ACT. ACT has been around for a couple decades, but in the last 10 or 15 years it's become increasingly popular. There are probably a number of reasons for that, but one of them is definitely the extensive empirical research which has shown positive outcomes for relatively short courses of ACT therapy for all kinds of disorders like anxiety, depression, OCD, substance abuse, even psychotic symptoms. ACT is considered an evidence-based treatment for many disorders. So what is acceptance and commitment therapy, or ACT? Is it a theory? Is it a set of techniques? Is it the same as cognitive behavioral therapy or CBT? The core of ACT is a theory of psychological suffering, which is going to sound counterintuitive. It is this: most of our psychological suffering is the direct result of our strong efforts to avoid psychological suffering. So put a different way, it is our very efforts to feel better and think positively that become part of the problem. Let's say that you are coming into therapy because you're anxious all the time. It's gotten so bad that you can't concentrate at work, you feel like you're going to panic in social situations, and you're not sleeping well because your mind is racing. So, what have you done on your own to get rid of this anxiety? If you're like most of us, you've tried a few things. You've tried pushing yourself really hard at work, or maybe quietly failing and hoping no one notices. You're avoiding social situations, and maybe you're taking a lot of alcohol or medications to get to sleep. So all three of these are short-term fixes, but long-term problems. You are definitely avoiding the immediate experience of failure, of anxiety, of stress, but you're setting yourself up for worse. When you actually lose your job, when you get addicted to substances, when you cut yourself off from important relationships in your life. In this situation, an ACT therapist might try a few different things. First, help you understand that your control agenda, which means your strategy for avoiding short-term discomfort, is part of the problem. It's actually digging you in deeper. And then it's all about increasing your psychological flexibility. So what does that mean? Here's where ACT as a therapeutic approach is itself very flexible. We can use behavioral techniques to help you be much less reactive to strong emotions. We can use cognitive techniques to reduce the strength of negative beliefs and rules. For example, you might have the unspoken rule, I have to feel better before I reach out to my friends. So a CBT therapist might ask you, is that thought true? But an ACT therapist might ask you, is that thought helpful? An ACT therapist can use mindfulness techniques to help you be more in touch with what's actually going on in your mind and body, as opposed to your interpretation of what's going on. And last, an ACT therapist can help you get a broader perspective, can help you clarify what is really important to you in life, the kind of person you want to be, and then help you identify small steps that move you toward that value. And this last part is the commitment part of acceptance and commitment therapy. Does this sound good so far? It should sound good. Does it sound simple and straightforward? The way I described it, I think it does. However, and I'm very sorry to say this, it is not simple and straightforward. If the process of getting unstuck were this simple, we would rarely get stuck in the first place. It turns out that logical thought and language are actually part and parcel of the problem. So a good ACT therapist will do things that are unconventional by traditional therapy standards. A good ACT therapist will offer metaphors rather than explanations. Maybe be happy when you're a little bit confused. Urge you to sing your fears to the tune of Jingle Bells. I'm not kidding about that one. And encourage you to move toward your discomfort rather than away. A couple of important distinctions. ACT is often categorized as a form of cognitive behavioral therapy, or CBT. However, ACT is meaningfully different from CBT. An illustrative example is this. CBT focuses on changing thoughts. For instance, challenging a harmful, irrational thought so that you can make it more realistic. ACT, on the other hand, is interested in changing your relationship to thoughts, disentangling you from beliefs and rules. Mindfulness is a core component of ACT, but ACT is different from, quote, mindfulness-based therapy. The psychological theory behind ACT did not get mindfulness from the Buddhist meditative tradition, and ACT therapists generally don't teach formal meditation. As someone who practices both ACT therapy and teaches mindfulness meditation, I believe there's a lot of overlap. However, the distinction I'd like to make is this. ACT is more active, more eclectic, more focused on the practical. ACT has no pretensions to being a spiritual path. It's a form of psychotherapy. Mindfulness, as it comes to us from the Buddhist meditative tradition, is at once more simple and far-reaching, at least in theory. It definitely requires formal meditation. It also may be more gradual in its effects. And as it comes to us, it is absolutely a spiritual path. There's a lot more to say, but let me leave you with one thought. ACT is really more than a collection of techniques, and it really is not intuitive. It really can't be practiced by a therapist who's just read a couple of books. An ACT therapist should have meaningful trainings. They should have practiced ACT in their own life. They should be confident in the approach. So another important fact here is that ACT is very active. So in my opinion, if you're looking for an ACT therapist, you should find someone who is confident in the approach, has some meaningful training to point to, and is personally very engaging.